I am Steve Ritter. I'm the founder of the Midwest Institute, and we are fortunate to have a talented and diverse team of clinicians providing counseling service to families in Chicago's west suburbs. And one by one, we're going to introduce you to our team of professionals. And today, we are fortunate to enjoy a conversation with Nicole Francen. So, Dr. Francen is a licensed clinical psychologist with a broad range of experience and passion for working with children and adolescents. She specializes in working with kids with autistic spectrum disorders and their families. So, hi, Nicole.
Hi,
Good to
thanks
see
for
you
having
today.
me.
So, I am interested in your therapy style, but I am currently interested in what you've adapted and what you've adjusted to our current COVID-19 quarantine shelter at home circumstances. Kids and families are normally used to coming to our location to get services with you, and it seems we've had to move to telehealth. So what's your approach, and what's different about telehealth, and what's the same moving forward here?
Sure. So, my therapy style is very much based on the relationship that I develop with each one of my clients. And so, I strive to develop that relationship with new clients just as I normally would. It feels a little bit different, but just like I would in the office, I want to make sure that our telehealth sessions feel like a warm, safe place where you can go and process difficult emotions, past experiences, and where you can learn new skills because that's very difficult to do in any circumstances. And right now, there's a lot of different sort of feelings and emotions and confusion and things that are happening right now. And so I try to create sort of a safe space within my telehealth room, and it's just for me and the client, so it's private. And through the way that we engage with each other, I try to make it as comfortable and safe as possible. And I definitely acknowledge that at first it can feel a little bit awkward to do video therapy, but I do feel like after a few minutes, after we kind of get going a little bit and get into the routine, it starts to feel a lot more natural.
Yeah, well, that makes sense. I'm thinking that the older the kid, the more familiar they're going to be with communicating through a screen, through FaceTime, whatever. But you see kids as young as 4 years old. So how do you engage a 4-year-old in telehealth services?
Absolutely. So I am by nature a non-directive play therapy therapist. Excuse me. So I like to let the child lead, and I follow and I process with them, and kind of join their world and experience life and their circumstances through their eyes. And with telehealth, I have to do a little bit more directive therapy at first. So I come up with some pretty fun, creative games, activities that we can do in the beginning to help it seem kind of interesting, make it feel a little bit different than school or YouTube videos or anything like that. I want it to be really specific to the needs of the child. And I found that over time, as the child gets a little bit more comfortable with therapy and with me and with their relationship, I am still allowed or able to kind of help them take the lead a little bit more, and then I can follow. So a lot of kids have most of the toys that we would maybe need for play therapy sessions. I don't use electronics or anything like that. So very simple toys that people might have around home, crayons, markers, paper, things like that. We can use those if appropriate, or I can send some things ahead of time to kind of have ready, whatever is most appropriate or easiest for the family. It's very important to me that I don't make it more complicated or more challenging for families, right? It's already kind of a challenging time. So whatever works best, we kind of modify and go from there.
Well, that makes so much sense. And I've seen how you have your office space here in Elmhurst set up. It's almost prepared for any developmental level and any developmental age of child. You have all the right tools and supplies and equipment to be able to manage that. And I'm guessing that families will take your guidance around what kinds of supplies and materials work best in a telehealth setting. But you're going to be eventually transitioning back to office-based services. What's your plan for that transition?
Absolutely. So my plan is to be following the state orders regarding shelter in place. So as long as those orders are current, then I will be doing things remotely. And then after that, I'm going to leave it up to the families and whatever they feel most comfortable with. If they prefer to have extended telehealth sessions until things feel a little bit more safe, a little bit more comfortable, then that's fine. If families are looking to kind of get back in the office, they want more of a hands-on approach, then we can definitely do that as well. So with our office setup currently, we are spacing out our clients so that there's no overlap. That allows us lots of time to clean the office from top to bottom, sanitize everything. For my adults, I'm making sure that we're still 6 feet apart, masks if we need that. What Everything that we would need to be safe and socially distant. With my kids, I still do the best I can to keep the 6 feet distance, and I sanitize every toy before and after the session, and just kind of go with it at that pace. So whatever the family feels most comfortable with is most appropriate, for the child, and what our sort of state guidelines are at the time.
Families have commented on how reassuring it is when they come into those who have come into the office during this. They come up and you can actually smell that it's been recently disinfected as you walked in. And then families have commented on the fact that we've actually taped off the carpet in the room so that you can see where the child's area is and you can see where the therapist's area is. And then there's a no man's land in between. It's 6 feet long where some of the equipment will have been set up in advance. And so it's been reassuring to parents to see that the office is set up for social distancing and that the disinfecting happens before and after each session. So I appreciate all the planning you've done around that. So Nicole, if someone's interested in initiating services, how would they get started with you?
Yeah, so I feel like the most difficult thing about starting therapy is taking that first step. It's a little bit intimidating, there's some uncertainty, but I just assure you to kind of take comfort in knowing that I'm here to understand you, not to criticize you or judge you. I want you to feel valued and heard for being who you are. And so I just strongly encourage you to try to take that first step. And then after that, it's a journey that you and I will take together. And you can see here, you can call me. My number is 815-575-6084. Or you can email me at nfrancen.psyd@gmail.com. So whatever feels most comfortable to you, and I'll respond in a similar route that you approached me with.
Well, thank you, Nicole. I really appreciate the time you've spent with us today. And we get nothing but positive feedback from the families about how comfortable it is to be in the office here when we can and how well you've transitioned to our telehealth services. So again, on behalf of our team here at the Midwest Institute and on behalf of the families that you serve and the community here in Elmhurst, thank you for all that you do.
Thank you.
All right.